Hello everyone, my name is Dr. Susanna Catalano and I work as a consultant at the Macula Center of San Pietro Fate Bene Fratelli Hospital in Rome under the supervision of Dr. Francesco Ciucci. I started my career as a laser specialist 43 years ago with Professor Lombroso at the Ophthalmic Hospital in Rome. Over the past 2 years, I and my team have used the nebulous laser to treat several retinal conditions involving both the retinal periphery and the posterior pole. Today, I would like to share with you 2 clinical cases we treated using subthreshold micropulse laser. We see a potential of using navigate subthreshold microsun pulses laser as additional therapy option in time of shortage of therapeutic agents. Why? Over the world, there is a growing incidence of eye disease like diabetic macular edema. At the same time, we are facing challenges because some important medicines are not available for the growing number of patients we need to treat. This problem became worse during the COVID pandemic. For example, PDT treatment for patients with chronic central serous chorioretinopathy. PDT may be difficult to offer as the porphyrin is hard to get. Also, anti-VEGF therapy has limitations in daily care. We are looking for ways to increase the time between anti-VEGF injection visits. This helps assign available doses to more patients. Yet it reduces treatment burden for patients. So we have evaluated adding nebulous subthreshold laser as another treatment option. Case 1. A 40-year-old Caucasian male with a visual acuity of 0.4 logMAR, presented with chronic central serous chorioretinopathy. He had persistent subretinal fluid for over 6 months, despite treatment at another clinic with eplerenone, topical and oral carbonic anhydrase inhibitors, and supplements like desmina and bromelain. On BScan OCT, we observed subretinal fluid in the vertical section, pachychoroid, and focal defects in the ellipsoid zone and outer retina. The patient provided a previous fluorangiography and ECGA showing leakage points. We performed an OCT angiography to rule out neovascularization, followed by a 3D wired OCT to locate the leakage point in the coronal plane. We identify a white dot near the superior macular vessel. We decided to proceed with nebulous laser treatment. Let's look at the video. Before starting the treatment, we confirm the correctness of the plan overlay over the live retina image and treatment setting. You can see the laser delivery. 50 pulses are delivered in a single take without any gap in between to maximize the effectiveness of the non-damage treatment. Here is the laser report. 240 milliwatt power, 0.2 second pulse duration, 100 micrometers spot size, 5% duty cycle micropulse mode. We saw the patient again after 4 months The OCT show resolution of subretinal fluid with no scarring. OCTA was also stable, show the same abnormality before the treatment. Retinal map show a clear improvement in foveal thickness, trended back toward normal values. Visual acuity improved to 0.0 logmar. We will continue to monitor him over the coming months. Case 2. A 60-year-old Caucasian female with type 2 diabetes for over 30 years and poor metabolic control. She had severe non-proliferative diabetic retinopathy and diabetic macular edema that did not respond to anti-VEGF and corticosteroid intravitreal injection. Her visual acuity was 0.9 logmar. OCT showed large intraretinal cells at the fovea, smaller cells in the inner nuclear layer, intraretinal edema in the outer nuclear layer, hyperreflective microdots, hard exudates, and subfoveal RPE atrophy. Despite a central macular thickness of 519 micrometers in the superior parafoveal sector, we decided to try repulsion laser with a 10% duty cycle. Additionally, we performed focal laser photocoagulation to close some leaking microaneurysm near the macula. At the 4-month follow-up, we observed a reduction of over 50 micrometers in foveal thickness and a slight improvement in visual acuity to 0.7 logmar. For this reason, we are considering a second laser treatment. Take-home message. Navigator system now use a slit lamp. Precision and safety. For navigated eye tracking, overlaying diagnostic imaging like OCT, fluorangiography, ICGA on real-time visualization of the retina. Subthreshold Navitas laser is effective and safe. Micropulsed ensures minimal collateral damage. Selective action on RPE without photoreceptor damage and retreatment possibility. Possible combination with anti-VEGF or corticosteroid to extend the interval between injection or for non-responder patients. In chronic epitheliopathy, we find it very promising, especially due to limited availability of verporfin. So we use microson pulsing laser treatment in addition to other therapy, especially when other options are not easily available. To implement subthreshold laser treatment, teaching and supervision are very important for very young ophthalmologists. This is more easy with the digital Navilas system. Thank you for your attention. If you have any question or are interested in collaborating, feel free to contact me at this email.